Principal Environmental Health Toxicologist of the Department of Health. I'm here testifying for Director Nicole Alexander Smith of the Department of Health. In the last session 2 weeks ago, somebody entered into the record October 15th letter that the Department of Health wrote to the FERC outlining some concerns related to potential health impacts associated with this project. The Department of Health recognizes that FERC has the main jurisdiction on the authorization of this project and that your role is limited to determination of whether the project is consistent with enforceable policies and standards. However, we feel that some of these concerns are still relevant some of the concerns that were outlined in that letter are still relevant to your evaluation. Section 300.8.d of the CRMP additional category B requirements specifies seven items that the applicant is required to address, and 2 of them are environmental impacts and social impacts. While health impacts are not specifically included in that list, the Department of Health strongly believes that any consideration of social impacts and environmental impacts necessarily must include an evaluation of health impacts. In the 2015 letter, the Department of Health recommended that FERC require the applicant to conduct a health impact assessment as a component of the environmental assessment. Health impact assessments consist of a comprehensive evaluation of a variety of health-related issues associated with the decision or project, and include a public process which enables the decision maker to identify the issues that are most important to the potentially impacted community. The letter discusses several issues that should be considered in such an analysis, including proximity of residential areas, schools, and other sensitive receptors to the facility, existing health burdens, including elevated asthma rates in residents in the neighborhoods adjacent to the proposed facility, increased vulnerability of the population in the surrounding neighborhoods to routine releases and catastrophic events due to socioeconomic factors, proximity of essential healthcare infrastructure, including the state's only level 1 trauma center to the facility, proximity of other facilities that handle, store, or emit toxic substances to the facility, and cumulative air quality impacts of emissions from construction or operation of the facility, including increased traffic combined with emissions from existing nearby stationary and mobile sources. In addition, the Department of Health strongly recommended that FERC require the applicant to prepare a risk management plan, or RMP, for both the proposed liquefaction facility and the existing LNG storage facility, and that the RMP should include a full and comprehensive process hazard analysis and take into consideration potential incidents at neighboring facilities. Note that to our knowledge, the FERC has not required the applicant to produce either a health impact assessment or a risk management plan to address the issues outlined. Concerns about climate change are also relevant to Section 300.8.d as well as Section 145, climate change and sea level rise of the CRMP. The CRMC staff paper discusses the ability of the proposed facility to withstand sea level rise, which does not address any other aspects of the project's relationship to climate change and public health. The proposed natural gas facility would expand the state's infrastructure for natural gas, a fossil fuel which, when combusted, produces greenhouse gases. While it's difficult to measure the impact of a single project, this climate change implications of fossil fuel burning have dramatic effects on local and global public health. Due to climate change, mental health, physical health, infrastructure, and the safety of our food and water will all be impacted by more frequent heat waves, storms, droughts, floods, and sea level rise. Additionally, pursuant to Section 300.8.d, the applicant also is required to address consistency with state and national energy policies. The proposed project should be analyzed in the context of its consistency with the Resilient Rhode Island Act and then meeting the 2035 and 2015 carbon emission reduction goals in that act, which are 45% below 1990 levels by 2035 and 80% below 1990 levels by 2015. The December 2016 EC4's Rhode Island Greenhouse Gas Emission Reduction Plan concludes that an 80% greenhouse gas reduction by 2015 would likely require a near zero carbon grid coupled with significant electrification of residential commercial space heating and on-road vehicles. If Rhode Island is to meet the commitments of the Resilient Rhode Island Act, it is essential that the state begin to move from fossil fuel energy generation as soon as possible, rather than to continue to commit to further fossil fuel construction. Thank you for
Ms. Martin,
Good job.